What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast. What's up, everybody? I know it's been a long time since you've heard my voice on the podcast, but I am welcoming myself back. For those of you who may or may not be aware, we started this during the pandemic as a little bit of a pandemic side project. And through one reason or the other, maybe adding 4 locations and almost doubling our team over the past 2 years, this took a little bit of a back seat. Zach's been doing a great job with it, doing some things with our sports residents, and you'll definitely be hearing me more as well in a hosting role. And I'm actually here today to put Zach on the spot a little bit. We're going to be talking a lot just about new grad expectations overall that relate to just entering the workforce, maybe external pressures, some of the popular narratives surrounding some of the options that new grads might have, and overall giving the new grad a better framework with regards to making decisions that are hopefully the most appropriate for them. So, Dr. Baker, a.k.a. Uncle Baker, welcome.
It's nice being on this side of things and being able to answer questions and not have to ask them. We'll see if we can keep this one under, 3 or 4 hours to get through everything?
We'll do our best, and thankfully there's no adult beverages, because if there was adult beverages here today, I guarantee you we could probably be here till sunset. And for those of you that are listening, it's probably about 9:30 or 10 o'clock. So diving right in, new grad expectations. I think they're higher than ever, and I'm not quite sure if there's any one thing, but obviously a multifactorial rationale as to why. What are some challenges that you think face the new grad when it comes to managing their own personal expectations and also potentially meeting the expectations of others?
So I think before we even get into that, we got to frame up the reason of why there are so many expectations. And I graduated in 2012. I think you were, 2011? So with that, there wasn't as many different options for what PT careers looked like in regards to, there was physician-owned practices, there were outpatient, but now you have all these other kind of more niche practices that are out there. You have hybrid online offerings, telehealth, online coaching. There's so many different types of PT jobs out there that what I'm getting to is when you talk to people of what their job looks like, everybody has a different answer. There's a lot more variance than what there used to be, for better and for worse. And I think the other part of that equation is the amount of ways that we can communicate with one another is way more rapid than what it used to be. And just the transparency is out there as well for what different work environments look like. And unfortunately, I think we see the different options for work environments, but we don't always know kind of the what and the why as to why that option looks that way. And ultimately, I don't think people often know what they even want. So they're being told what's good, they're being told what's bad, they're being told what's out there, and they never even turn around and ask themselves, what am I actually looking for?
Yeah, and I think the first word that comes to mind when you're framing that up is the word filter. There is so much information. Dare I say it's information overload. So for a student who maybe is entering that time period where they're starting to think about life after graduation, what are some recommendations that you have so that they can better filter information and really find out what resonates with them the most, as opposed to maybe taking all this information in and getting caught on the wave, so to speak, of somebody else's dreams, journeys, and aspirations?
I think the first thing they have to do is realize that key word that you said, life after graduation. Your first job is your first job after graduation. It doesn't mean for the entirety of your career. It doesn't mean what the next 15, 20, or 30 years is going to look like. So before you even get into kind of planning out what your career is, you need to figure out, where do I want to be after graduation? Do I want to move back home? Maybe you've been away for school for a few years. Maybe you are away from home and you like that area that you're in. So you need to figure out, where do you want to be? what type of field in PT do you even want to be in, which I think most people have a good idea of that, but you need to get that macro before you get into all the subspecialties within that field. And then after that, I think you need to appreciate like what other big life events have or have not occurred that may influence my current decision making. You know, have I settled down in a certain area with a certain person? Do I have other life or personal things that I want to get out of the way? And then after that, you can only plan so much. Sometimes you just need to get started. Find a job that looks like it's a place that you'd want to be at. Shadow there. Make sure it hits all the big buckets that you're looking for. And it's not going to be perfect, but you don't even know what quote-unquote perfect looks like. And so you get in there, you get in the trenches, and you start putting in reps and figuring out what resonates and what doesn't resonate.
And that's one of those situations where just taking your first step, putting yourself in that new environment, and not necessarily thinking that first environment actually has to be perfect. I can't tell you how many people I've spoken to recently that are either talking residency, or they're talking starting their own business, or they're talking about, the perfect setting in their hometown that probably doesn't exist. Instead of focusing on perfect or best or that destination location, finding the place that really is just best suited for them. So, and I mean that from a development standpoint. So for the new grad that maybe doesn't have the perfect residency or has had the entrepreneurial journey where it makes sense for them to start their business right after graduation, what are some questions that you feel like the new grad should be asking of a prospective employer to make sure that they're setting themselves up for success?
I think a lot of this comes down to what do you value as a clinician, meaning is patient volume or your overall workload something that's of significant concern, or not even concern, of interest to you? Do you like working in a slower paced or a faster paced environment? Do hour-long treatment sessions or 20-minute treatment sessions resonate with you? Do you like to be a part of a team, or do you like to be more solo? And some people like to be in a clinic where it's just them and the patient, or maybe them and one other clinician, whether it be a PT or a PTA or a tech or an aide. Others, and we've had a few people that have joined our team that they were at another job that they loved, but they didn't like the aspect that it was just them and maybe one or two other PTs, and the large group environment that we had where they're interacting with 5, 6, 7 other PTs on a daily basis. That was something at that point in their career that they were really striving for. So I think other things that you want to keep in mind too is, what does this look like just from a day-to-day standpoint? Meaning, am I in an area that checks a lot of boxes in regards to I'm working with the patient clientele and demographic that's appealing to me? I'm seeing a volume of patients that meshes with what I feel comfortable and competent with. The overall work environment matches the work environment I want to be in, meaning is it more traditional? Is it more kind of office setup, or is it more of an open, maybe gym type setup? But then the next part is, are you going to be spending 5 minutes a day getting to and from work, or an hour and 10 minutes? And is that going to eat into your ability where maybe you love being at work, but that 2.5 hours you're dedicating getting to and from work and prepping for work, eating away at your opportunity to do other things that you enjoy outside?
And, the topic of today is about expectations. And when I think of some of the things that you were just mentioning, it is that work-life balance. And you almost need to make sure that you're making considerations, or that you're having certain expectations of yourself in addition to the place that's employing you. It's not just about choosing the right first place for you to go to, but it's about making sure that it fits into your life. Things like a commute, things like PTO, things like flex scheduling, making sure that they're supporting you from a continuing education standpoint so that you can do things outside of the office that both support, what you're trying to accomplish inside. Let's take things back a decade or more when it comes to what you did after graduation. You've been in a situation where you've tried a couple different things. You've had a lot of different exposure to areas of the profession. You've also had, side hustles. You've had other things that you had going on in addition to being a very, very involved family man. So, those first few years, what kind of was going through your head as you entered the workforce?
Yeah, so I graduated back in 2012, and I was in my final clinical rotation in PT school when I was going through the application process. So ideally, I wanted to have an idea of where I was working already set by the time I graduated. And I was fortunate enough to get that. So I am from Central Maryland. My whole extended family is here. My wife, we had dated all through PT school, got engaged while we were in PT school, and we knew that we wanted to end up somewhere in that central western Maryland area. So that in and of itself already kind of narrowed down the types of workplaces that I had to choose from. I wanted to be an outpatient PT. I wanted to have a sports kind of slant to that population that I was working with. And I ended up applying at a couple of your larger corporations that are outpatient PT. And then I also applied to a private practice. And that was ultimately where I ended up going to. The private practice was in Frederick. It was about 35-minute commute from where I lived, which was honestly like the extent of what I wanted to do. Because like Josh had mentioned, I was married at the time. I had a wife that had some expectations of me being home. And not just being at work all the time. And we knew that we were going to go down the route of having kids sooner than later. So having something that was convenient at home to where I lived was a big factor in that. Private practice compared to the larger corporation was something that resonated with me at that time. Because when I was interviewing, I don't know how to describe it, but I got vibes that I felt more like I was going to be part of an intimate team, and the people that I was going to be directly working with were part of the interview process as well, which spoke volumes to me. I remember at the other places I interviewed, it was with more regional directors and managers that realistically I would not have any contact with outside of that. Whereas when I went for my interview at the other place, I met the owner, I met the receptionist, I met all 4 PTs that I was going to be working with. They let me stay there for the day. They showed the schedule to me. Like, it was just an open book kind of policy, which I really appreciated that. And then it was a outpatient population. I saw some sports athletes. Wasn't the exact mix that I was looking for. So I supplemented that by doing a kind of a side hustle where I was doing strength and conditioning on the side, which honestly, I thought that was one of the best things I could do because it gave me a very low-risk opportunity to trial some business initiatives that I had that along the way I found out, I like being involved, but I don't like being the person who is pulling all the strings with that. I liked the interaction and the patient care and the training aspect of it more, but it made me appreciate some of the logistical influences with that. And it also got me better at programming and implementing a plan of care with a healthy population of athletes, which until you know what that looks like, it makes it really hard to forecast with the injured population. So, that first place, it was a place I felt comfortable with, ultimately led to me transitioning over to Rehab to Perform after about 2.5 years, because I got to a point in my career where I wanted more than just patient care. Which is what I had at the previous employer, and I enjoyed working there. But kind of my ceiling of what I was able to do there was patient care. And I had some education initiatives, I had some leadership initiatives, some things that at that place of employment, unfortunately, couldn't be fulfilled. But I had this opportunity that allowed that to happen.
So you were able to kind of structure your early years according to the way that you wanted to. You were able to mix things outside of the clinic to support some of your interests. Inside of the clinic, I do think of the word residency. That is an area that a lot of people are talking about. You helped spearhead our sports residency, as well as get our orthopedic residency up and running with Dr. Tim Bufolco. And the residency really for us wasn't a tremendous option. I mean, I don't know, how much you looked into it, but I remember looking at 0 salary residencies during the time period where I was finishing up school. The PT students are obviously in a much better situation, often getting some kind of dare I say, like prorated salary based on how many actual clinical hours that they have. But for the people that are having an expectation of either jumping right into a residency because they want more of that formal structure to become board certified, or potentially somebody who maybe, they take a year off, but they're going to jump back into it, what are some things that you feel like they should consider and are some healthy expectations of that particular situation?
Yeah, and I think you hit the nail on the head that the residency education has really evolved since we've come out of school. The whole reason I did not pursue it was there was none geographically close to where I wanted to live. So short of relocating and moving somewhere else, which wasn't really an option, there wasn't any other really route to go with that. So I think individuals who are pursuing residency, the first thing you always have to ask yourself is, why are you even pursuing it? And is it because you can find a residency that has a direct career path into the area that you want to be? Maybe you find a residency that puts you into college sports or into pro sports. And that is one of the most direct ways to get into that, is through one of those residencies that puts you there. Maybe the residency has mentorship and structure to it that you really crave in your early career years. That's where you have to ask yourself, can I only accomplish this through residency, or could I accomplish that same mentorship and structure through just a really good place of employment? And I would argue that you can find employers that will do that for you. I'll also argue you can find a lot of employers that will promise you the world and then never follow through on that. So in your early phases of your career, when you are looking at jobs, and if mentorship and ongoing education and development is something that you pride yourself on and is of interest to you, and you have an employer that says, oh yeah, we have an onboarding program, we have a mentorship program, ask them what it is. And they should be able to clearly articulate what happens, when it happens, and how they guarantee that it happens. And I think what you often find is you fall into situations where there may not be the infrastructure to support it, or there may not be the accountability to regulate it, meaning they don't have anybody who is directly involved with it. It's just kind of, it is gone, whoever is available on an as-needed basis, which makes it very tough to track and progress from there.
So the expectations, regardless of residency or your first job, largely are things that, sounds like the individual. You're recommending the individual needs to be able to explore. They need to be able to ask the right questions. They need to have a certain level of self-awareness about whether or not this is actually the decision that's best for them. I think that's probably the hardest thing that I have had when it comes to interacting with either DPT students or new grads that feel this pressure to jump into being a business owner. And I regularly find myself asking the question, why, in addition to what makes you feel like you would be best suited for this? Because I think sometimes largely you've got, because of the information overload we referenced in the beginning, you have young people who might feel like they need to adapt or adopt into this popular narrative, residency being one of them, being your own business owner being another. What are some things that you've found successful for yourself that have allowed you to kind of come up with what's best for Zach Baker at any given moment? Because I think largely you've been somebody who's done a good job of being introspective, being very aware of what your needs and wants are, and kind of meshing that with all of these other factors in your personal life, not just the professional life.
I think it's a dynamic process, and what you crave and what you're passionate about is going to evolve throughout your career. What is important to you in regards to flexibility of scheduling, commitments to your craft, commitments to your business, commitments to your family or other passions or pursuits. There is more to life than being a physical therapist. There's more to life than being a father or husband or a wife. There's a lot of other things that kind of fill everybody's cup, and at different points in your life, that recipe is going to change a little bit. One thing that you talked about earlier is the pressure of having a business initiative from day one. There are stressors and demands that come with everyday life. There are stressors and demands that come with clinical practice. There are stressors and demands that come with running and operating a business. trying to navigate all three of those at once at the same time is incredibly difficult. Now, there's people out there that can do it, and there's people that have proven that they can do it very successfully. They are the less than 1% that are very public about how well that's gone for them. They are not the 99% that are showing all of the struggles that go with it. I would be naive to say that there are not benefits of being a business owner or running things in a manner that you think you have more control and more influence over. Unfortunately, you don't get a lot of those benefits, or you don't appreciate and realize all those benefits until you've taken the lumps and you've taken the bumps and bruises along the way. And I worry about individuals who are taking the lumps just from everyday life. They're taking the lumps from early clinical practice, and they're taking the lumps from early business initiatives, and not really being able to tease out which one is the rate limiting factor. Or maybe all three of those sets of lumps are relatively minor in and of themselves, and if you were just dealing with one individually, it's not that big of a deal. But when you have all three of them, they have a compounding effect. And I think, by whether it's dumb luck or design or just kind of how the cards fell, I think that's kind of how my career up to this date has fallen, where early on I didn't have any business initiatives. I kind of, got stuff at home squared away, got my first job underway, spent 2.5 years there really figuring out what I liked, what I didn't like, what I thought I did well, and stuff that I realized I do not do well. And of the stuff that I don't do well, is it just because I don't care and I don't find that stuff enjoyable and it's just not intriguing to me? Or was it more exposure, experience, and just clinical aptitude? And that's more kind of skills that you can develop. So I think just finding out and being true to yourself of what your strengths, what your areas for improvement are early on, then you can leverage them. And I think it's tough to run a business, one, when you don't know the operational side of a business. It's also very tough to run a business when you don't even know what you are trying to market, because you don't know what you do well. And you get stuff trying to run a business of maybe something that isn't really in your wheelhouse or really in your expertise, and some of that stuff you just don't find out right from day one. And you can find an exception to every rule, but I do think being able to look at all of the different areas that can pose problems and figuring out how can you kind of titrate these in and out so you can more regulate your problem solving in each of those areas tends to be a good recipe.
Yeah, I think it's very interesting. Again, just related to the business side, when I will talk to people and for one reason or the other, they're just dead set on opening a business right out of school, and you largely talk to them and you're a little bit concerned because it's not really an entrepreneurial journey. There's not a place where they've been able to have safe to fail environments for them to kind of experience, and use the word titrate, but have these small micro dosing of entrepreneurial successes and, of course, failures. But yet they feel like they're going to be qualified day one to juggle life after school, bills, student loans finally becoming a reality, getting your reps in actually as a full-time clinician, in addition to business, yet you've had no business experience before. And I know there's, a lot of great business mentors in our profession, but no amount of motivation and education and day one mentorship can really accelerate a learning curve to take somebody from 0 to 60. And I think that for the people out there that maybe want to jump into the business side of things, you have to put yourself in a position where you've had some kind of a side hustle, or there's been some kind of work that you've done where success and failure can occur as a result of that. If you're working and no matter what the work is, you get the same outcome, I would argue you probably haven't learned a lot of the basics of just what it means to found something and have things riding on your back. But, Zach, if we were to present some parting advice, especially based on all of the students that you've seen over the years here at Rehab to Perform, what are some things, as the month of May is around the corner, people are going to be taking boards in these next couple months, that the upcoming new grad class of 2023 should be considering entering the workforce?
I think easiest thing to do is reflect back on your clinical experiences and figure out during your clinical rotations, where were you the happiest and where were you the most excited to go to work every day? And I think that will really put you in the position of what field of PT you're most likely going to end up in. But all of the other experiences that you may not have been overwhelmingly excited about going to, what were other takeaways that you took away from that? Were there certain things that either your CI did or certain ways that that company operated that really resonated with you that either just made sense or things that you wish could be incorporated in other places? And that'll give you a good idea of when you're looking at jobs, you can start to make your list of like, what are my non-negotiables? What are my need to have versus my nice to have checklist? And that can help dwindle down the types of jobs that you're looking for. And then in regards to starting your career, be proactive. Reach out to people, start developing a network. And developing a network doesn't mean a sleazy, salesy, gimmicky, just cold call to everybody. It means find people who have values or have experience that you think highly of and just connect with them. Get your name out there, pick their brain, see if they have any opportunities or other resources for you to look into. And then from there, be open-minded about where you're going for your first job, where your career takes you. Figure out, what do I even want to do in the next 6 months? I have summer coming up. Do I want to work through summer? Or do I want to take summer off and start my career after summer and fall starts and then hit the ground running from there? And just really start to realize you're about to enter the workforce. It's going to be an imperfect process, but the beauty of it is you have control over where you are working. Nobody's going to force you to work somewhere. Nobody's going to force you to stay there. But I think the ones who have the most success are the ones that at least put themselves in a good situation, and then they're very transparent with everybody else who is involved in that situation. Ownership, colleagues, patients, other interactions they have. And the more transparent and open, and honestly, just be a genuinely good individual, things often work out in your favor, and that good experience turns to a great experience. And if it doesn't, then start figuring out where else you can go from there.
As always, you don't get the nickname Uncle Baker by not giving tremendous advice. You've interacted with a ton of students over the years. You're our chief clinical officer. You headed up our residency program. People are going to naturally want to reach out more for questions and advice. Where's the best place for them to do that?
Easiest place is either through social media or email. Email is Dr. Baker, Dr. Baker at rehab2perform.com. Instagram's just another easy one. You can shoot me a message on there, ZDBaker30.
Awesome. Zach, thanks again. And I'm sure we'll be doing this again in future episodes.
Absolutely.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.